Good evening. My topic of presentation is incidence of macular edema following cataract surgery among diabetic patients in a tertiary care center. And cataract is the leading global cause of blindness, and cataract surgery is one of the most common operations performed worldwide. Cystoid macular edema remains the most frequent postoperative complication to result in impaired vision. A higher incidence of macular edema after cataract surgery is reported to occur in eyes with diabetes, and worsening often occurs after surgery in eyes with pre-existing diabetic macular edema. With the availability of OCT, that is optical coherence tomography, we can obtain qualitative and quantitative parameters of macula better and explore the relationship of macular status before and after cataract surgery in diabetic patients. Objectives are: primary objective being incidence of macular edema following cataract surgery among diabetic patients, and the secondary objectives are to correlate the changes in macular thickness following cataract surgery with preoperative HbA1c level, and to analyze the morphological patterns of macular edema following cataract surgery in diabetic patients. And the study design, it is a hospital-based, prospective, non-comparative observational study in patients attending ophthalmology or OPD of Government TD Medical College, Alappuzha. And the inclusion criteria: patients with type 2 diabetes mellitus undergoing cataract surgery for whom preoperative OCT is possible. And the exclusion criteria: patients with macular edema due to diabetes or any other cause who has taken intravitreal injection within 3 months of surgery, patients with any other macular pathology, patients with intraoperative cataract surgery complication, those who are not willing. And the study method: sample size calculated using this formula and found to be 29. Variables used in the study includes visual acuity by Snellen chart, OCT, and HbA1c 2 weeks prior to surgery. Macular thickness will be analyzed with Cirrus HD OCT machine based on the 6 into 6 mm data cube captured by the macula cube 512 into 128, and the central subfield normal range 220.5 into to 294.8 microns. Fundus and central foveal thickness will be assessed at 1 and 3 months during follow-up. Independent t-test was used to compare qualitative parameters between categories. For all statistical interpretations, p less than 0.05 was considered the threshold for statistical significance, and the analysis was done by SPSS version 20. And the results: mean age group was 63.9 plus or minus 7.2. And the distribution according to duration of diabetes: 41.4 patients had duration more than 10 years. And according to diabetic retinopathy, 41.4 patients had pre-existing diabetic retinopathy. And according to HbA1c, 55.2 were uncontrolled diabetes, that is HbA1c more than 7. And discussion: 41.4% had macular edema with 24.1% cystoid pattern, 10.3 spongiform, and 6.9 mixed. CFT in diabetic eyes with retinopathy increased by 43.9 plus or minus 39.7 at 1 month postoperatively, which was greater when compared with eyes without diabetic retinopathy. And CFT in diabetic eyes with a duration more than 10 years increased by 43.6 plus or minus 39.4 at 1 month postoperatively, which was greater when compared with eyes with a duration less than 10 years. CFT in uncontrolled diabetic eyes, that is more than 7 HbA1c, increased by 35.1 plus or minus 34.1 at 1 month postoperatively, which was greater when compared with eyes controlled diabetes. Decrease in CFT from 1 month to 3 month posto was greater in controlled diabetes when compared to uncontrolled diabetes. As expected, there were significant improvements in BCVA at all post-operative examination time periods, with 1 line improvement from 1 month to 3 months post-operatively. And the conclusion being, post-operatively, CFT increased in all diabetic patients, with greater increase found in patients with pre-existing diabetic retinopathy, with uncontrolled diabetes, and with diabetes duration more than 10 years. And the limitation being small sample size. And these are my references. Thank you.
A couple of questions from my side. Thing is, what was the duration between the surgery and the onset of diabetic macular edema?
I followed the case at 1 month,
Okay.
then at 3 months.
Okay. So the thing is, my second question is, how did you differentiate your diabetic macular edema versus other causes like cystoid macular edema?
Sorry, sir. The range was CFT range was 220 to 294. Anything more than 294 considered as macular edema, and the cystoid spaces by analyzing the OCT pattern. That by analysis.
Did you exclude those with cystoid spaces or they were included?
Actually, they were included, but intravitreal injections were not given within 3 months of surgery.
Yes, no. So, sir's question is, how do you know whether it is a diabetic macular edema
yes, sir.
or a cystoid macular edema
due-
following cataracts?
Uh,
So, you just included all of them.
All of them, sir.
So, you could use the term pseudophakic
Fake
macular
macular
edema.
edema.
You're not committing to either.
Either.